Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, December 6th. I'm joined by Deputy County Executive Ken Jenkins for our weekly update on Westchester County issues. And of course, we began this series back in March of 2020 based on the issue of COVID, the COVID pandemic infection that first affected Westchester County and, of course, the rest of the nation and the rest of the world. Our topic today will be almost completely driven around COVID, as it was last week, as we're watching the movement in numbers and try to make some sense of it for you so that you have an idea of what actions we intend to take at the county government level and what's going to be required of each of us as residents, as citizens, people involved in organizational settings in order to deal with the latest iteration of the pandemic. As you can see, we have reached the month of December, and with December comes consistently colder weather, and we're seeing some of the same realities that we saw a year ago in terms of the pandemic, which is more people being indoors, and then also the holiday season. We've just recently passed Thanksgiving and Hanukkah. We're looking ahead now to the Christmas season, New Year's that follows it, and an increase in connections between other people. And that social connection oftentimes is a vehicle for spreading the disease, and we'll see cases rise. We're going to give you some basic information and then try to put into some perspective, working off of numbers that we have through Saturday, December 4th. We have 2,867 cases of coronavirus that are treated as active cases. Individuals who have been diagnosed with the disease over the last 2 weeks. They have not gone through the 2-week period of time in which their antibodies will clear them of the illness, and so that is, they are still an active case. They haven't yet become dormant. And with that comes the not just the reach of the disease, with how many individuals, 2,867, what percentage of infection that represents. Just in the last 24 hours, we've had 11,624 people take a test for COVID, and 388 of those individuals tested positive. That is a 3.3% infection rate. Now, keep in mind, the number of people who decide to take a COVID test are often people that are taking that test because they think they've been exposed. It may not be reflective of the society at large. Those of us who don't believe we've been exposed, don't have any symptoms, don't take the test, and may in fact represent a larger cohort of people that are not infected. So the infection rate for the days of those people that have had a COVID test within that 24-hour period, these numbers were posted as of Saturday, December 4th. The number of people who are hospitalized in the various hospitals of Westchester County, there are 11 hospitals in Westchester County, numbered 84. 84 people hospitalized. We'll give you some comparisons in a few seconds. And we have had, over the course of the last week, 1 fatality to COVID. Now, when you look at the disease, we often talk about how many people are affected by it. That's active cases, and the percentage of active cases is the infection rate. The degree of severity of the case is then reflected next by hospitalizations. People who don't just have a mild case of it, either are unaffected or mildly affected by it. They stay home for a couple of days, they get over the symptoms, but they have the need to be hospitalized. That is the larger number of 84 out of the total that has been rising over the last few weeks. And then, of course, the ultimate case of COVID is those that affect people's ability to survive. We've had 1 fatality again over the last period of time, over the last week, and that number over the last 4 weeks has been 4 fatalities in the last 4 weeks, so it's averaged 1 a week. Those numbers since November 10th are low fatality numbers. Every death is an emotional moment. Every death is a loss, so we don't ever want to make it a statistic. But we look at fatality numbers as the ultimate failure of whether or not we've succeeded in trying to keep people safe and alive. And to have 1 fatality a week is not as good as 0, but it's a lot better than what we've seen in prior weeks. We'll show you the comparison in a second. The hospitalization numbers of 84 have come up in the last month. About a month ago, we were 29 people hospitalized to COVID. Now at 84, that is an increase in the number of people hospitalized. Keep in mind, the most critical statistic is if a person needs hospitalization, do they have available hospital beds to accommodate them, and in some cases, ICU beds for a higher level of treatment. In the 11 hospitals in the aggregate in Westchester County, we have all told in the vicinity of 2,700 hospital beds and in the vicinity of about 160 ICU beds. These beds are not empty on any given night because many people are hospitalized for a wide variety of things that have nothing to do with COVID. Certainly, there are people who have heart attacks and strokes that need to be hospitalized. There are people who have elective surgery for knee, hip, other operations which may not be done as an outpatient scenario, may require overnight hospitalization. Each of the hospitals manage their inventory in order to accommodate the needs of their community. In a few minutes, we're going to ask Susan Fox to join us here at the podium. She's the president and the CEO of White Plains Hospital, located here in downtown White Plains with a service area that's much wider. People from many of the surrounding communities see White Plains Hospital as their local hospital. It's a very dynamic institution. It's expanded over the last number of years, many different services, and of course they are one of those 11 hospitals that's on the firing lines for COVID patient treatment. And Susan will talk a little bit about what her hospital is doing to satisfy state mandates, but also to provide the best possible hospital care to the people that she serves. When we deal with the number of people who are hospitalized, the statistic that we have at this point is that 57% of the 84 cases of hospitalization are people that are either not vaccinated or were unknown status in vaccination. Excuse me, we presume that if your status is unknown, you're not in the system as being vaccinated, that most likely you are unvaccinated. So 57% of the individuals who are hospitalized as of the current number are people unvaccinated. The remaining 43%, that might strike you as a high number of people who have been vaccinated, but in that number are including people who have only received one dose of vaccination, not a full 2 doses. It certainly also includes people who may have underlying health issues, and so at the same time they are double vaxxed, they're also dealing with compromised immune systems for which the vaccination may not work as effectively as it would on a relatively healthy person. I mentioned this the last time we spoke. We're mindful of the loss of Colin Powell. And Colin Powell, the former Secretary of State, Chairman of the Joint Chiefs of Staff, died a few weeks ago at the age of 84. He died of COVID-related causes, but he had other underlying issues as well as having been double vaxxed. And so there are limits to what the vaccination can accomplish in a person who may be compromised. So we don't have the breakdown statistics of those individuals that were either partially vaccinated, not fully vaccinated, or had other underlying cases. In general, 57% of the people of these 84 that are hospitalized fall in the unvaccinated situation. Now, when you look at these indicators that I've just mentioned, and I want to go over this, and I'd like to use the graphic that gives you some comparisons. Active cases, infection rate, hospitalizations, and deaths per week. Those are 4 different metrics to look at when trying to judge where are we at in this pandemic. How close are we to a point of crisis? What is being taxed in our system when we have each of these indicators up higher? What we're providing for you, I believe on the screen you'll have it, is an example of where we were a year ago, November 29th, arbitrary date, almost a year ago, and the numbers of active cases, infection rate, hospitalizations, and deaths per week 1 year ago today. And we use that comparison because we're coming out of Thanksgiving, and we are on our way toward the Christmas holiday season. Last year, Hanukkah came later in the year, but roughly comparable in terms of what's happening in the society. The second column we give you is where we were on January 18th. That is the peak of infection impact that we had prior to vaccinations. Now, vaccinations began slightly before that in Westchester County, but they were not universal at the outset. You may remember it took us a while to get our protocol together and to start reaching at the county center that 22,000, 2,200 people a day being vaccinated. So it was it had started, but it had started in a more modest way, and that was the peak that we experienced at that period of time. The third column gives you where we were when we had the Delta variant peak. We reached the lowest point of infection throughout this whole pandemic in late June. And when we reached that point, vaccinations were still fresh, double vaccinations were still fresh, very low infection rate, very low number of people infected. Then it started to rise just at the end of June, beginning of July, with the Delta variant being introduced into the society. And the peak that we had with the Delta variant came on August 28th, where we had the highest number of active cases at that time. And then the fourth column gives you the most recent data that we have for Saturday, December 4th. Let me compare a few of those things if you're looking at the graph. First of all, where we were today versus a year ago. Whatever concern we have today in Westchester County, today we have 2,867 active cases. A year ago today, pre-vaccination, we had 5,764 people that had active cases of COVID. The infection rate today, 3.3. Now that's up from what we've had in prior weeks and months. A year ago, the infection rate was 4.7%, and it was on its way up to a higher number, which we'll touch on in a second. Today, we have 84 hospitalizations. That's a lot more than 29 that we had a month ago. A year ago today, we had 250 people hospitalized to COVID, and that is obviously a significant amount more than what we have today. And where we have lost one person in the last week, a year ago, in a similar week, we lost 14 individuals, 2 people a day, over the course of a week. And it's important now to look at those two factors. First of all, what they do point out is the efficacy of vaccinations. The fact that we have 92+%, we're approaching 93% vaccinated according to state statistics. We hope all of those statistics are accurate. We use them and report them, as do the other counties. But with almost a 93% vaccination rate. We see the difference when comparing the first column to the fourth column. We are in much better shape today than we were a year ago today. And when people are looking at this and they see and they hear about Omicron and they hear that cases are rising, let's put it into perspective where we are. Today, we are roughly half of where we were in active cases a year ago today. We're much less in terms of hospitalizations. Our fatalities are much, much lower, and our infection rate is lower as well. Now, where we were a year ago, same time of the year, cold weather, one holiday behind us, another major one or two ahead of us, we were rising at that point in the number of active cases as we are today. So if a year ago we were that far ahead of where we are today, when did we peak out a year ago? We peaked out 2 weeks, roughly, after New Year's Day. And that was through the Christmas holiday and through the New Year holiday throughout the course of the winter. And we peaked out at 11,658 active cases, pre-vaccination, 11,658. So if you look at where we were a year ago today, we were only halfway to the number of active cases that we would have when we reached our peak after the holiday season was over. Our infection rate, which a year ago was 4.7, rose in that second column to 6.6% infection rate. And the number of people we had hospitalized by January, 567 people. Now keep in mind what I said before, 2,700 hospital beds in total in Westchester County. And we are not an island. There are people who live in the Portchester, Rybrook area, and Greenwich Hospital is the hospital they might go to in proximity. If you live in North Salem, you might go to Danbury Hospital as a matter of practicality. And anybody who lives in Westchester County and has business or other dealings in New York City might very well have been hospitalized in New York City. So the 11 hospitals of Westchester are not the universe, and we certainly have people hospitalized here coming from other counties around us. That's certainly true of the Westchester Medical Center, but it's also true of every institution at some level. But it's important to note that where we are today is nowhere near yet what we saw in the pre-vaccination peak. And that tells me that how these 4 indicators move in the days to come will be the determining factor of what actions we take as a government. But we are not yet at that kind of a situation that requires us to go to the extreme measures that we would need to have done if we'd never had a vaccine at all. And for those people, it's a relatively small percentage in Westchester, that are vaccine resistant, I wouldn't even say hesitant, people who resist having a vaccine, these numbers are declarative. And now we've gone a year. This is not a week, this is not 2 weeks. You can discuss what the long-term effects of anything is. The long-term effects of us living is that we all will die. But in terms of a proximate analysis, after a year, vaccines have been the single most effective tool in reducing hospitalization, illness, and fatality under COVID. And I don't believe that's arguable. You might find somebody on the internet who says something else. By all means, share whatever internet information you have. But to us, clearly that's the case. Now, those numbers, 11,658, dropped down. We dropped down as the weather became warmer and as we started to vaccinate. And we vaccinated aggressively in this county, as we've already discussed. And by the time we got to the low period in June, the numbers were smaller than any of the numbers on this grid. But Delta variant came along. Why do I give you the Delta variant peak and where we are today? Because people are concerned about what Omicron may be. Omicron has not yet hit Westchester that we know of. But I think none of us doubt that we'll see a case of Omicron. We might see one before the day is over. And when we see one case, we'll see more than one case. We've been through this dance before, and we understand that we are no more impregnable to this disease than any other corner of the earth. And quite frankly, because we have a very affluent and a population that conducts business internationally as well as domestically, the chances of it happening in Westchester sooner rather than later is much greater. But the peak of the Delta variant, remember how much hype there was about the Delta variant? That was the peak of the Delta variant, 2,800 cases, 108 people hospitalized, and 4 fatalities within a week. Still significantly less than what we saw pre-vaccination. Now, what we've been told by medical science is what will vaccinations do and what won't they do? They will not cure the disease. They inhibit you from getting the disease, but they don't eliminate it. We've heard the vaccine efficiency numbers to be 95% efficient. One of them may be 90% efficient. What does that mean in real-world terms? 95% efficient means 1 out of every 20 people may in fact get the disease. And if it's 90% efficient, 1 out of 10 may get the disease, 9 out of 10 will not, or will be more resistant to it, depending on what their underlying health conditions are. If you have diabetes, if you have COPD, if you have asthma, you're more vulnerable to getting it, even with the vaccination. What the vaccination has proven by statistics and also by the reports of medical doctors, it reduces the severity of the disease. So we may have a higher infection rate, we may have a higher number of active cases, but we do not have proportionately higher hospitalizations, and we do not have proportionally the same number of fatalities. And that's very important. Of every 3 people that died in Westchester County due to COVID, 2 of the 3 died in 2020. Before vaccinations began. Now, we have lost people since vaccination began, and a lot of that has to do, again, with the health of the individual who contracts COVID and what their age is. I think probably the single most important dynamic in COVID has been age. I say that as a man of 68 years, that the older you are, the more vulnerable you are to this disease, but it does not mean that you can't get it if you're younger. I reported in the last report my 4-year-old grandson came down with a case of COVID, as did my 32-year-old son-in-law. So it is possible to contract the disease, but how serious it is depends on the health of the individual, and it depends on, frankly, the things that I could never know as a person who's not a medical practitioner, the nature of the person's physiology and so forth, that helps them fight the disease better in one person than in another person, regardless of underlying circumstances. I state all these things to say this. We've had 4 fatalities in the last 4 weeks. That is a good statistic. We've gone from 29 to 84 hospitalizations. That is not a good statistic. 84 is still well below where we were a year ago, where we were at the peak in August, and certainly where we were in the peak in January. But 84 is higher than 29. We're moving in the wrong direction. And if you tie the movement to the weather, where it's getting colder, people indoors, holiday season, the projection line is that that number would continue to climb at some level. And we hope the fatality number will stay low. So as we posited this as a government, we envision a step-by-step approach. And I think we've distilled it down to a 5-step approach. Step 1 through step 5, the degree of indicators will determine whether we go from one step to the next and how robust our response will be. We are not looking to put mandates in for sport. We are not looking to restrict economic realities. We are not looking to meddle in everybody's business circumstances unnecessarily. It depends on infection rate and hospitalizations and deaths and active cases. Right now, as we approach what will be step 1 of our effort, which will be a declaration, a state of emergency declaration, which we will authorize this week. We'll make sure it covers the ground we have to cover. We're going to look at those counties that have already instituted them. Ulster County has instituted it. Monroe County has instituted it. Erie County has instituted it. Their levels of infections and hospitalizations and active cases are different from ours. They're more severe. And there may yet be state action taken by the governor, which is within her prerogative, which would create statewide circumstances. But at this point in time, the state policy has been to let local governments, local counties make these decisions this year. That was not the case a year ago. That's the case now. And so we're looking to see how many of these indicators are we crossing, how many of these are like tripwires that we're interacting with. Our infection rate, 3% and under would be a point at which we feel pretty comfortable. We're slightly over that now at 3.3. We think that might rise. Hospitalizations at 100, we're not there yet, but we see a line that would take us over 100. Deaths, 10 per week. We're very hopeful we get no per week. One per week is below that number. That indicator is not there. Active cases, 3,000 active cases. We think that triggers the first stage, which is a state of emergency. That emergency declaration will be crafted, will be made public, and will be shared with everyone. With that declaration comes no specific mandate or action at this point in time. However, this is the moment in time when I have to ask each of you to understand that we are now crossing to a level of emergency, and that emergency requires each of us to determine what can we do on our own, voluntarily, freedom though it be, before we have to take government action on behalf of the whole of society. I would prefer that this moment be a moment where every individual, every business, every not-for-profit organization, every community organization now looks and says, okay, we understand that COVID numbers are rising again in Westchester County. What are we doing? How are we doing it? What can we do voluntarily? How do we, on ourselves, make sure that mask usage is more widespread to stop the conveyance from me to somebody or somebody to me? What can we do to ensure that our workforce or the people that we deal with every day are vaccinated? Now that we have boosters out there, those of us, and I'm one of them, that are double vaxxed, don't consider yourself properly vaxxed until you get the booster shot. I believe I'm getting mine this week at some point in time, and now it's open, eligible to everybody. You can get a local pharmacy. You can get it through one of our mechanisms. Ken in a second is going to talk a little bit about the satellite locations that we have coming up. But this is the moment in time in which each institution will start to look at how they operate and how they have to adjust to circumstances and numbers that are rising. If those numbers increase dramatically, we're going to work on some specific metrics. At some point, we'll share the next level metrics. If the infection rate goes up significantly above 3%, arbitrarily 5%, 7%, if the hospitalizations go from 100 to 150 to 200 to 250, if the number of deaths start to multiply, become more like 10 a week or 20 a week. We saw that a year ago we had 14 deaths in a week. We forget when we have few deaths what it's like to have that many. And back at the very beginning of this pandemic, we had 75 deaths in a single day. I think we were stunned by it. We couldn't believe it. We had to rent a refrigerator truck to help handle the amount of fatalities that we had. We've seen nothing like it in my lifetime, and I certainly don't know whenever we've had a non-wartime setting where there are that many civilian deaths in a night and then followed by another night somewhat similar. But this is now the challenge to us. If you prize your freedom, if you prize your individual action, this is the time to use it. If you are involved in an organization, you have an office of people, you run a company, you run an institution, educational institution, medical institution, you name it, you have the opportunity now to look at these numbers, talk amongst the leadership of your organization, say, what can we do to try to reduce that? We in the county government are going to be doing exactly that. We already have a mask mandate inside the various office buildings of Westchester County. That we established a while ago. We did not lift it. We also have a mask mandate on the Beeline bus system where you have to wear a mask. I know people complain about it, and not everybody follows the rules. And as you can appreciate, I can't put a police officer on every bus to look around and direct you to put your mask on. But you've got to know, the more this infection spreads, the more people get sick, the more they die, and that's a choice that you and I make, not just to protect ourselves, but to protect the people around us. Now, if you're waiting for the government to act, we'll act. We'll act with force, but we're not going to act just because somebody else is doing something in a neighboring jurisdiction. But let us see what we can do right now to get as many people vaccinated and boosted as we can right now. We are right now working on pediatric vaccinations, and we're launching a campaign, Get Boosted. I think we have a little graphic out there which you may have seen. It looks like, the Rosie the Riveter's muscle, serious-looking muscle, and a way for you to strengthen yourself by getting that booster shot. I'm going to get mine this week, and I hope you'll get it if you've been double vaxxed already. And if you've been one-dose vaccination and you're hesitant about going back for the second dose, get it, because you do not want to be on my statistics sheet as hospitalized next week. You don't want to be on this statistics sheet in 3 weeks as a fatality. I don't want to be one of these statistics. I don't want somebody to mention me here as having formerly been your county executive because I didn't do what was common sense, and I think that's where we stand now. Every business, every organization, every one of us, every family, as you prepare for the holiday season, now you have to look and say to yourselves, what do we have to do? What do we have to do to try to stem the tide? If we can stem the tide or lessen it, because there are environmental reasons why the numbers are going to go up, then we can avoid the worst case scenario. If you look at this as step one, a declaration of state of emergency, it gives the county some powers. We have no intent to use those powers unless we consult with business community, people, various institutions, and so forth. But we will use the power if the individuals amongst us are not having an effective result in dealing with this pandemic. With that, I'm going to ask Ken Jenkins to outline where we are with some of our satellite clinics. I've had a chance to go to a couple of them this past week. Ken has as well. We go just to see how the county is setting them up. This is not the only place you can get a COVID vaccine. You can get them from local pharmacies. Westchester Medical Center is still working with the state on the program. The state is operating the Yonkers Armory again as a vaccination center. The county will be operating out of both our White Plains and Yonkers clinics, and then in addition we have some plans to re-energize the county center, not on the level that it was previously, but on a level where we'll have some vaccinations there. But the satellite locations, particularly focused on pediatric vaccinations, has been our immediate focus. Ken?
Thanks, George. And as the county executive continues to say that we are not defenseless in this particular fight, vaccines are the way that we're able to get through this. So we have second dose vaccination at satellite sites at the Mamaroneck Avenue School. Today and tomorrow, the 12/6 and 12/2, and 12/7, those are second doses in the afternoon. Again, for these particular sites, you need to continue to talk to and look at the Westchester Gov site at health.westchestergov.com. For the satellite locations, those usually are working with that municipality and that school district. On Wednesday the 8th, we're going to be at Rhinebeck High School, Rhinebeck Middle School from 2 to 6. On Thursday and Friday, we're going to be in the Rye Middle School. Again, all of these are second doses, but for those individuals that are in and around those communities, and as the county executive pointed out, you have so many choices that we did not have initially when we first started the vaccinations, where you can go to your local pediatrician, if it's an elementary middle school student, as well as your local doctor, your CVS, your Walgreens, and certainly all of the hospital facilities that have some of the vaccinations available. Not everyone has pediatric ones, and vaccine.gov, you can get that information there. And sometimes you even have a text message to go back and forth on those. Next week, on Monday and Tuesday, we're going to be around up at Byram Hills, and then Portchester on Wednesday at the middle school cafeteria, Thursday in Chappaqua, Saturday in Peekskill at the middle school, and then the following weeks we're going to be in Sleepy Hollow, and we have had great partnerships that we want to shout out, especially our Ossining Volunteer Ambulance Corps and Scarsdale Volunteer Ambulance Corps, along with all of our other partners out there. Certainly Empress has been helping out. We've had, again, so many people working together to have a local vaccination satellites, and whether that is in a school, whether that's in a community center, or anywhere else, in a church, a faith-based organization, we're going to continue to do those and partner with those organizations. Again, we are not defenseless in this particular fight. We're urging everyone to continue to, if they haven't gotten vaccinated yet, make sure you get the second shot. And if you have Johnson & Johnson, you can get boosted after 2 months. Moderna and Pfizer, I believe that's after 6 months. And I know that all of us that can be boosted now, you should get boosted. I know I have mine. Thanks, George.
Thank you, Ken. Last week I had the chance to go to Cottle Elementary School in Tuckahoe, and also to the Webster Elementary School in New Rochelle to see how those operations were set up by the county. Each dynamic is a little bit different, but our health department staff is really doing terrific work. I want to personally thank, from our team, Emily Saltzman and Christopher Steers, both based here at our executive floor, who are responsible for the overall working of these things. We work very closely with the school superintendents. I had a chance to see Dr. Amy Goodman from the Tuckahoe School District when we were there, when I visited there last week. And I think it's very important that we have that relationship between the school districts as well to help provide these vaccines and make things go smoothly. One of our other partners in all of this is the community of hospitals in Westchester County. Here in White Plains, the White Plains Hospital complex is a very impressive one. It provides medical services for so many different circumstances, and since I work here in downtown White Plains, I'm very happy to have such an outstanding institution just a few blocks away. I hope whether I need it or not, it's there, and I hope I don't have to need it. Susan Fox, who's the president and CEO, is a true leader in the healthcare industry. She's recently just been elected head of the Westchester County Association, which gives her additional work and additional grief on top of the things she has right now. But as far as the hospital is concerned, she has done really a brilliant job working with a very active board of directors, board of trustees, and also with the medical professionals in that institution. And that includes both the medical doctors, the nurses, and all of the other folks who work there. So we're very happy to have Susan to come here and for her to talk a little bit about the challenge that a hospital has in managing its inventory to try to be available to handle COVID patients and at the same time function for all the different things in life that happen that may cause us to need their services. So with that, Susan Fox, President, CEO of White Plains Hospital.
Thank you so much. Thank you so much to the county executive for inviting me to be here today to talk about our very timely issues. And the major reason for me being here is in response to the governor's executive orders last week to talk about the possibility of hospitals needing to shut down elective services. And the county executive and I had a conversation last Friday about what all that meant. And we've been through a lot. I think we're going on 22 months of managing this. And the good news is that we've learned a lot. The bad news is it's not over. The good news is we've learned a lot. And to be able to provide those lessons is really important. And I think a lot about what you spoke about this today is really making sure that we're not doing too little, but we're not doing too much, and we get it right, and we understand, and we act from the facts and our experience and what the issues are of today. And so when we heard about the new executive orders, I think we're all in a good place in that we want to be cautious, we want to learn, we want to be prepared, but at the same time, we don't want to overdo it. And if we remember, hospitals were asked in the beginning of the pandemic to stop elective surgery, to make room for patients in the hospital. When we think back on the last 22 months, that volume, that need for hospital capacity for us here locally was really about 6 to 8 weeks. We know that the pandemic started in March, and by May, our numbers were really coming down, and we were able to reinstitute elective surgery. And so when we talk about that being one of the triggers, as a hospital leader, we have a lot of things to balance. Yes, we want to be prepared for what might happen, but at the same time, we don't want to go backwards. And we know that during that time, a lot of people didn't get services that they needed. They put off their health care. And so we're very sensitive to that. And so just want to reiterate that it's very understandable and realistic and important, and to make sure that we're learning those lessons, that we're working together. And what we think about, again, the last 22 months, 20 of those months have been about managing our capacity. And the numbers have gone up and down over those months. And we've learned to communicate, work together as individual hospitals, as health systems, as regions across the state to load balance. And we have a lot of great experience at how we've done that. And I know that when we look at what are the right things to do today, from the governor's office to the county executive talking about the important things to be looking at and when to act, those are all being taken into consideration, and that's key. Talking about which hospitals would be asked to stop elective surgery is really going to be based on what the county executive talked about today. There's not going to be any hard and fast, and I salute that. One of the things that we also have to think about is, what's changed. And why is this coming up today? So certainly the Omicron variant we're worried about, but we don't know what that means yet. The other major issue for healthcare organizations is staffing. Our staff are tired. Our staff are burnt out. Our staff keep rising to the occasion, but some of them have retired. Some of them have left the profession. Some of them have chosen to leave because they didn't want to be vaccinated, and that's a very small amount, but it all adds up to staffing being an issue for all of us. So that is, along with the new variant, and us seeing the numbers going up slightly, is a little bit of the storm that's causing this focus, but again, in a way that we feel very positive about working together and being prepared. At White Plains Hospital, when I first heard that I was on the list, or the hospital was on the list, it was a matter of clarifying the intent. And again, we did that last week. The county executive did that this morning. We talked to the governor's office last week, and it was announced what the major concerns were. And very much in the same way, I think out of the governor's office, they're looking at statistics, they're looking at capability, they're looking at helping hospitals, helping communities that need help when they need it and not overdoing it. And so at White Plains Hospital, just want to give a little bit of color. We're 100% vaccinated, with many of our staff getting boosters every day. Our goal is to make sure that all of our staff have boosters. We know that after 6 months, we're eligible for that, and most of the healthcare staff got vaccinated in the beginning of the year, so it's time. At our peak, in those first 6 weeks, we had about 240 COVID patients at White Plains Hospital. Today, we have 15. Okay, so just to put that in perspective. We've also learned a lot in terms of how we care for patients. We didn't know how to care for patients. We didn't know how to protect ourselves. We didn't have the vaccine. And so this many months later, we have all that information. And in fact, we've dedicated one of our units to caring for COVID patients over the last year, and I'll call them our 4F Dream Team, which have been amazing and really have provided the best outcomes to patients. That said, and it was mentioned a little bit earlier, the patients are sicker because of the vaccination rate, because of how we know how to care for patients. We're seeing those patients be less sick. And while at the peak of the pandemic for us, which was that first 6 to 8 weeks, at White Plains Hospital, we have 16 ICU beds. We needed to flex up to 87 ICU beds. Today, only one of those 15 patients are in the ICU. So a lot has changed. We've learned a lot. We don't know what tomorrow will bring. But as was said a little bit earlier, I was named the chairperson of the Westchester County Association for next year. And whether it's leading a hospital or really thinking about the health of our county, it is through working together. It's through learning lessons. It's through making sure that we're all doing our part. It's making sure that we're prepared. It's making sure we pull those triggers when we're ready to pull those triggers and not before. That's going to keep us the healthiest county. And I think we are a great example of getting it right and doing it right. I'm just coming off of a stint as a board member on the American Hospital Association, where I get to sit together with colleagues across the United States, and so many differences around what's happening in each of their communities. And I'm always very proud to say that we are a county that has probably one of the highest vaccination rates. And when we say that, we're best prepared. And I hope everybody believes that at this point and sees that at this point. And as County Executive Latimer said earlier, what can all of you do? Making sure that you get vaccinated, making sure that you get boosted when you can, making sure that you wear masks, making sure that if we do put more stringent parameters in place, that everybody understands that there's a lot of good people trying to protect our county, our state, our country, and following those directions in a way that we'd all love to say that this is in the rearview mirror. And we're anxious to say that, and I hope we can say that soon. And until then, I think, by working together, by doing our part, whether it be at the county level, at hospital leadership level, at the business level, and at the community level and an individual level, that we're all doing our part to make sure that next time we're up here, we'll be saying something very different. So, thank you.
Thank you. Thank you, Susan. Appreciate it. Thank you. That was Susan Fox, who's the president and CEO of White Plains Hospital. And again, we thank her both for the hard work that she's done in dealing with the pandemic, also for being with us here today to give us a little insight into what happens at that facility. So as we close the report, we'll look to see if we have any questions from the press. If there are, I'm happy to try to address them. Catherine Chaffee, our Director of Communications, please feel free.
Okay, so the first question comes from David Proper from the Journal News. Do you think the state needs to be more, do you think the state needs to make more decisions in its action to handle COVID?
Well, I think the state is in a different situation than we are in the county. I'm familiar with the size and the scope of the state, and it's vast. The western part of the state has much more of a crisis at hand right now. I've alluded to the fact that I've spoken to my colleague, Mark Polenkars, who's the county executive in Erie County, and they have the crisis that we do not have yet in terms of hospital room availability and high level of infections and so forth. When the governor decides to act on a statewide basis, she's going to have to consider that in ways that we may not face, and then try to figure out how to do these things across the board. Whatever mandates come down from the state, we obviously will legally honor them, as we did last year when the prior governor issued those mandates. But her strategy at this point has been to be more decentralized in her approach, allowing each of us who run counties or the city of New York to do our own strategies. And so we take on that responsibility. I'm not at all shy about doing the things that we have to do in our area. But if a superior level of government, a governor or the president, decides that there's other actions they need, they will be making those decisions from a platform that I'm not on. So I can't see the scope of everything that's happening from one end of the state to the other. So we hope that whatever does happen, it will be things that we can work with and we can help put this behind us.
Next question is also from David Proper. Why haven't you mandated vaccinations for all county employees yet, and is that being considered now?
Well, I think we've had a tremendous vaccination rate amongst employees. The real question is, first of all, how many of your employees have been vaccinated? If I told you that I had 3,999 out of 4,000, then you might not worry about whether they were all required to be vaccinated. See, I think what's happened, and it's implicit in the question, I'm not upset with the question, but the philosophy is that there must be a mandate in order to accomplish the end result. And I read the society that we live in a little bit differently. I think the mandate is what you do when you have no other alternative. You try to get people in a free society to take intelligent, free action and get as close to compliance as you can. At some point, when you have 3,999 vaccinated out of 4,000, that last person's unvaccinated status is not the difference of whether you have health or not. It's unwise for that individual, as we've proven by the statistics. They're still more likely to get the disease if they're unvaccinated. But we did not implement in August a mandate, and we're seeing high percentages of our workforce vaccinated, in some ways higher than other places, because keep in mind what's happened. Look at some of the private sector entities. There's some medical facilities that did this, where they said, if you don't get vaccinated, we're going to fire you. And a number of people said, fine, fire us. And you have 100% vaccination, but you also have a much lower workforce as a host of people that were fired. Had they stayed in the workforce, your vaccination total wouldn't be 100%. It'd be lower than our vaccination workforce is. So I think we're making intelligent decisions. We reserve the right to mandate anything in the future if it's required. What will trigger it? A much higher infection rate, a much higher number of active cases. We have 2,867 active cases. Actually went up a little bit overnight, 3,099. We're nowhere near 11,658. If we get to 15,000 active cases, 20,000 active cases, I might very well mandate it. But you'll know that I'm not mandating it out of ideology. I'm mandating it because the crisis has spun out to a level at which it can't be managed in these other, more reasonable, less intense ways. If we have to make a mandate for people to wear masks, if we have to make a mandate that you can't go into a restaurant unless you're double vaxxed, triple vaxxed may be ultimately where it goes. We live under the banyan tree of New York City. New York City's 9 million people. We're 1 million people. New York City captures all of the news. The mayor of New York City, who'll be completing his tenure at the end of the month, has been very clear what his political philosophy is. We're in the same party. We share some things in common, and we differ on quite a number of things. He takes an action, and immediately somebody rushes up to me and says, gee, why didn't you do what the mayor of New York did? Well, why didn't the mayor of New York do what the county executive of Westchester did? Well, you don't compare the two jurisdictions that way. What we're doing in Westchester has kept Westchester people safe. Our numbers are lower. Our vaccination number is higher than Brooklyn's. Our vaccination number is higher than the Bronx. It's higher than Staten Island. What does that mean? When you force people to get vaccinated before they can go into a restaurant, you're trying to get them to be vaccinated. We didn't have to do that to get to 93% vaccinations. They had to do that in New York City. So don't compare the actions, compare the results. And I think our results stack up very well with other areas. Now, I reserve the right, and not because I'm arrogant, but because if the numbers get higher, if we start losing a lot of people to this disease and it starts to flare up again, Omicron or whatever other variant may come down the line, we may have to use those tools. But let's not use them prematurely, because there's going to be pushback. It's going to be hard to enforce it. You can you'll do this, and then you better have a police officer everywhere you turn to get everybody to comply. So I think our reasonable strategy is working, and we have to keep on it, but graded by the degree of infection.
Next question from David Proper is, can you elaborate on using the county center for vaccinations again?
Yes, when the state made the decision to move the operations that they had with Westchester Medical Center as their partner to the medical center facility, I think it made it probably logistically a lot easier for WMC. And the nature of mass vaccinations wasn't the fulcrum anymore in these things, where you needed to have a center where you could do 2,200 people a day. You're at a point now where, yes, you want to sort of mass vaccinate pediatric vaccinations for a smaller number of children, but you don't have to reach them at the county center. You can reach them in each of their different elementary schools. For the booster shots, because people are already vaccinated, you don't need to have a singular location. You have it available, and a person says, I need my booster shot, I'm going to call my local pharmacy. I'm going to go to my medical facility, as Ken said, the West Meds and the Caremounts of the world. And so there are a number of different ways to do it. You don't need the mass vaccination site. Having said that, we still have a lot of people that have to get boosted. And so we think that having the county center, not perhaps using all of the same facilities we had before, but a more limited portion of it, will provide us a better physical environment than using our current clinics. We have a clinic in downtown White Plains, we have a clinic in downtown Yonkers, but they are of limited size and scope. They were never intended to be a mass vaccination location. We did set up a mass vaccination location at the gym at the community college during last winter, when we needed a site in addition to the one that we had at the county center. And so we're looking at going back to the county center, but we have to work out the logistics of it. We'll certainly announce it. And we think that will help us in the boostering effort that we have to come.
His next question is, what power does the state of emergency give you?
Well, it's sort of broad-based, and I think what it really comes down to is we can impose quite a lot of mandates that you saw the state impose a year ago. If you recall what happened, the governor of that time went to the state legislature for extraordinary powers, which they granted him to deal with the pandemic. And he used his executive power, and he was very clear to those of us in government below, county executives, mayors, town supervisors, other entities, that the decisions would be made out of Albany on all of these different things. So we managed our recreational facilities, we managed what happened inside our building, but we had no general management outside of that. His extraordinary powers overrode intrinsic powers that belong to the Board of Health, the Commissioner of Health, and by extension to the county executive. So the new governor does not have those powers. You may recall they were retracted from the former governor by the state legislature for a number of reasons. And the current governor did not ask for them to be reestablished. So by doing it in that fashion, it devolved to us the ability to do some of those things. But I don't even want to talk about what happened then, which is the shutdown of all industries. Quite a lot of industries were shut down, and the governor in that point in time determined what was an essential industry. They could continue to operate. What was an essential industry could not operate, had to close their doors. The number of people that could go into an office building was decided, by the governor and the executive branch. How Susan Fox and her colleagues managed their hospital inventory was dictated by the state, because the state empowers those entities, is the licensing agent for nursing homes and for hospitals and so forth. That level of power, to me, is not necessary at this stage of the game to deal with the crisis as we have now. So I'm not worried about, do I have that power? I think what we're looking at, first and foremost, is to get people to understand how they have to use their authority and their world to deal with the size and scope of events before we come in and say no event over 250 people, which is what happened last year, if you recall. And the governor would set the limit. How many people could be at a high school graduation? He set the limit. I don't want us to be there. I don't think that's a productive way for the society, unless this thing spins out. If this thing gets to, again, 150, 250 people dying like that, then you take those measures. But you don't take those measures short of that. The state of emergency allows us to be able to do certain things, and as I've promised to Susan in personal conversation, as well as I have to business organizations, we're dialoguing as we speak with the various organizations in the community to discuss what they can do before we determine what we can do or what we'll do, and we're going to try to do as much cooperatively as we can. And you will see a greater emphasis on wearing masks. I think that's clear. I think you'll see a greater emphasis on getting booster shots, and the Get Boosted program with PSAs and social media is the initial outlet of this. And, I hope David and, in his efforts in writing in LOHUD will devote some time and attention to that. Because if you devote some time and attention to the effort to get boosted, you're doing the public a favor by reinforcing that third shot is necessary. Look, I've always said all the way through, I think we can get through this, but we'll get through this doing it together.
The next question is from Jonathan Gordon from News 12 Westchester. Yes. He asks, what do you think about New York City's private sector vaccine mandate, and will you consider a similar one in Westchester?
Well, at this stage of the game, I don't think it's warranted in Westchester. I think the New York City leadership is looking at the challenge in New York City. Again, they're 9 times the size of Westchester County. Their metrics are different than ours. They have a much more diverse population. People have said, well, their infection rate is here versus yours. I always am mindful of the fact that people who get tested are the baseline for the infection number. It's how many people are positive out of the number of people infected. And I have a gut feeling that more Westchester people get tested without direct knowledge that they might have the disease. The less people that get tested, you could have a very low infection rate out of that. So I think New York City's infection rate is much more difficult, much more urban environment. You have a larger percentage of people for whom English is not their primary language, and I think it's a much greater challenge down there. And I think, the mayor has shown his willingness to do these kinds of mandates, and I think we'll see how it works. We'll see if it turns the tide. If it's more effective, then we'll look at it, and we'll see if we copy it or not. But I'm not looking to copy it on day one. This is the first place in the nation that has gone with this kind of a mandate. So let's see what happens. I don't think the crisis has reached that point in Westchester to warrant it, and I also think that in a small d democratic society, people will judge wise or unwise actions, not because you have the legal authority to do it, but whether or not you did it proportionate to what the level of crisis was, because you are asking people to do things differently. And if you can solve the problem short of doing that, then that's what you would try to do. If you need to use that tool, then use that tool if that's what's necessary.
Next question comes from Martin Wilbur, and this is our final question. He asks, in reference to the 4 criteria that you set out, do all 4 thresholds have to be met in order for the state of emergency to go into effect, or is there some discretion involved?
Well, we're putting the state of emergency into effect, given where we are today. Just to give rough numbers, I think we have a graphic on this. We have posited that prior to these numbers, we would continue to deal with this without benefit of saying we needed an emergency declaration. Infection rate over 3%, hospitalizations at 100, deaths 10 per week, and active cases 3,000. We have met surpassed 2 of those metrics. We look to be on the path to passing the 3rd metric. So given that, we're going to move to a state of emergency declaration. We don't need in the future all 4 to line up, but we're not going to do it just on the basis of one metric. And as I said, each of the metrics are kind of different in what they tell you. I think probably the single most important metric is how many people are hospitalized, are severely sick, and does it tax our hospital system? And if we can manage that, that means those people can get proper treatment. If they get there early, they can get the monoclonal treatment. If they get there later, they'll still get the finest treatment they can get, and they can recover. And so they don't become the fatality statistic, which is ultimately the worst of all the statistics to look at. But if the hospital capacity of the county can handle and manage the level of severe illness, hospitalizations, then we are managing the disease as best as we can. I tend to think, from a layman's standpoint, we have COVID here forever. I tend to think that every year we'll probably get an annual COVID shot. Because what I've watched now over 2 years is the seasonal reality of things. It drops in the spring into the summer. We go outdoors. It starts to rise a little bit in the fall, not greatly, but you hit the cold weather and the holiday season, it starts to peak up again. And I'm watching it happen a second time, and I think that's probably what's going to happen in the years to come. We can't operate society every day in a COVID crisis mode. We've got to be able to figure out what is the level of this disease that will be there, as other diseases are. We don't want to minimize it and ignore it. Some people early in the pandemic said it'll be gone in a couple of days. There's only 15 cases. That's insanity. And then on the other side of the extreme, there are people who will say the society needs to be shut down for a year or 2 because that's what has been. And that too is insanity. You have to be practical. There are other health problems that are generated by having a society pivot around this all the time. You deal with kids in education. If you have kids trying to learn remote on a permanent basis, they will not learn what they need to learn. They will not acculturate the way they need to acculturate. You could lose a generation of young people if this were to be multiple years of being outside the classroom teaching. I'm not a teacher, but that makes logical sense to me. So we've got to figure out how to manage this. And if there are no more questions, I'll use this as the launching off point for the close. We've talked about indicators such as active cases, hospitalizations, fatalities, infection rate. But let me tell you the 3 indications. I've said these 3 things before. These are the 3 things that matter most to me. Thoughtfulness. Will every one of us think about this before we react on emotion or ideology? Will we be thoughtful? Will we look at statistics, not trying to prove a predetermined point of view, but to let it teach us what our response should be? Thoughtfulness. Self-discipline. It is not easy to teach yourself to do things that you are not accustomed to do. You all see I'm in a weight loss effort right now. I'm having some success, but it's very difficult every day. I'm trying to teach myself the self-discipline necessary every single day. For those of you out there that have kicked the smoking habit, for those of you who are out there who have kicked the alcohol addiction or a drug addiction, you know far better than I do what it takes to have that self-discipline. It is hard to do, but we as a society have to show self-discipline. I've often made the reference, probably too many times, to what I was told by my mother and father during the Depression and the World War, how they had to discipline themselves, how there were a host of sacrifices that had to be made. Now we have to show self-discipline. That's the second dynamic. And the third dynamic is perseverance. And perseverance is very hard. You get tired of doing something the 3rd day and the 50th day and the 365th day and then the 3rd year. You're tired of it, but we have to persevere. We have to show that we are stronger as a people, that we can show thoughtfulness, self-discipline, perseverance. Those 3 things will get us through, as will vaccines and masks and those other things. If we can show those things as a society, we will overcome this. If we can't show those things, we're going to have a very rough go. I have confidence. I'm an optimistic person. I think that we are, as individual people, as collective people, we will show the thoughtfulness, we will show the self-discipline, we will show the perseverance. We've been doing it already, we can do it some more, and we'll come to a successful conclusion. I'm George Latimer, Westchester County Executive. Thank you for watching. We will be back next Monday at 2 o'clock for a further update. If there are any other issues that we need to report to you on, we will do that, and we look forward to seeing you. We hope you have a very safe holiday season.